Hi, everyone, and welcome to our podcast, Racial Equity in the Fight Against COVID-19. My name is Omer, and I'm in my third year at UTSC, and I'm here joined with Rani.
Hi, everyone. My name is Rani, and I'm in my third year as well at UTSC.
Today, we bring you episode 1 of our 3-part podcast series, Racial Equity in the Fight Against COVID-19. The project was brought forward through UofT's COVID-19 Student Engagement Award. The goal of this project is to demonstrate the importance of collecting race-based COVID-19 data to ensure an equitable response to the current pandemic. Research shows that Black communities are disproportionately affected by certain chronic conditions such as HIV, diabetes, food insecurity, low income, and unstable housing in Canada. The effects of COVID-19 have further exacerbated these already present health disparities, and we believe it is our responsibility to take measures that will help these vulnerable communities respond accordingly. Although the province has started collecting race-based data, earlier measures should have been taken. In times of crisis, the inequitable experiences of marginalized populations need to be identified and addressed early on, as these groups disproportionately bear a greater burden of suffering.
This podcast is one of the many aspects of our project, as we'll also have a website summarizing all of our research findings. We hope that you will all take a look. Further details regarding our website and how you can access it will be communicated in future podcasts. These project activities will further allow public health officials to identify the unique situations and interesting identities of certain populations, which puts them at a greater risk of the virus.
Our special guest for our first episode is our very own project supervisor and UTSC Health Studies professor, Nida Mustafa. Nida Mustafa is a PhD candidate in social and behavioral health sciences at the Dalla Lana School of Public Health. Her doctoral research explores lived experiences of chronic pain at the intersection of culture, gender, and immigration. Nida is also a course instructor at the Interdisciplinary Center for Health and Society, UTSC, and is very passionate about the academic and professional development of her students. Thank you, Professor Mustafa, for being with us today.
Thank you for having me. And I just want to say I'm excited and I'm honored to be part of your project. So I wanted to thank you all for having me as your project supervisor. And I'm excited to be on this journey with you and help guide you in any way that I can.
Thank you.
Thank you, Professor. So in today's podcast, we want to, touch upon the surface of the racial inequities individuals in the Black community and also Canada face. We also want to touch upon the many questions that have been addressed by Black community health centers across the GTA. And overall, the goal of our project is to really highlight the importance of the collection of race-based COVID-19 data. So to begin, we want to highlight the concerns surrounding the risk of contracting COVID-19 in the Black community. So people are concerned about the lethality of it, and especially with individuals, working as personal support workers, so PSWs, and also frontline low-wage workers. They're not able to get laid off and are therefore at an increased risk of contracting COVID-19. The highest numbers of cases are cluttered in the city's northwest neighborhood. And just last week, the city announced that mobile testing will come to Toronto's hardest hit region. Can you give your perspectives on why mobile testing was available weeks ago in less burdened neighborhoods, but was not offered in the neighborhoods that have the highest proportions of inadequate housing and poor access to healthcare? Also, how does this speak to the systemic discrimination the Black community continues to face within the healthcare system?
Mm-hmm. So yeah, I think these are really important questions. These are questions that need to be asked. And I think it comes back to the value and need to collect race-based data generally, not just related to COVID-19, right? So one of the main issues, the reason why, these communities are being hit the hardest is because there's no prior knowledge of the needs of the community, what resources are available there, right? What health outcomes are already present in the communities. And so collecting race-based data is so necessary, even prior to something like a pandemic, in order to be better prepared, right? So if we had that race-based data, if we knew what the needs of the communities were, if we knew the health concerns, what resources are needed, then even before such a pandemic hits, there could have been funding, there could have been resources allocated to these areas to better cope with something like this. And so I think it's very important to emphasize the need to collect that type of data from even before something like this happens. And again, I think, like you mentioned, it does point to that systemic discrimination or neglect of not prioritizing certain communities that need those resources the most. And again, those are tied to, as you mentioned earlier, the social determinants of health, right? Those who live in lower income or who have precarious work because of their employment, or who may be newcomers or visible minorities, they are more marginalized. And so resources do need to be allocated to those areas even more so.
I think you really touch upon a great point. The fact that the individual, lived experiences of certain communities are different across the GTA and also across the world as well. And even prior to the pandemic, people wonder why Black people are so hesitant to, go to the doctor and seek care. It's because we're not recognized. They face neglect. And you're right, prior to the pandemic, we should be collecting this type of data because as public health officials, you need to identify populations that are at risk. And especially with COVID-19 really highlighting and bringing about these health inequities that are present within our society, we're still neglecting the Black community. And it's really frustrating that like last week was when mobile testing was implemented in the hardest hit region of Toronto. And that's why we really want to demonstrate the importance of collecting race-based COVID-19 data. And it's kind of sad and frustrating also because we have leaders, we have Ford, other leaders, neglecting the collection of race-based COVID-19 data. They say they don't believe in COVID-19, race-based COVID-19 data, but rather postal code COVID-19 data. So you touch up on a great point. So I want to thank you for that. So on to my next question. So I know the virus has affected many of us psychologically, as we take extra precautions when we go outside to go shopping. And even if we come down with a sore throat one day, we become anxious and worried. Being at an increased risk due to working essential jobs, living in inadequate housing conditions, and still not having testing readily available in these communities, how big of a psychological impact do you think COVID-19 has and continues to have on the Black community?
That's another really, really important question. I've actually been reading articles about community leaders, and I think some of them you will be talking to as well, who've actually raised the issue of mental health issues in the community. And so I do think it's going to have a very strong impact, and maybe not immediately, maybe not right now, because people are just trying to, get through their days, continue working, have the income to support themselves, their families. So it's kind of, nonstop right now on the go. But I do feel that, in the coming months, even in the next year or so, when things maybe stabilize a little bit, this will have a very strong, profound effect on the psychological health. And again, as you mentioned, of, marginalized communities who have the COVID issue now, but that is only exacerbated preconditions that were already there in their social circumstances. And so COVID-19 has only made those worse. And I think that the effect of that will come out, if not immediately, but definitely in the coming months. Another point related to that is access to mental health services and healthcare in general. When you're talking about pockets like this or marginalized communities, there's already issues of access. And so if a community is going to be, going through a huge impact like that psychologically, the access to healthcare and mental health services need to be there, readily available. And so that might be another issue that does come up in terms of actually accessing healthcare services.
Mm-hmm. Thank you for that. Yeah, those are all really good points. It's like COVID-19 is not a problem that has just come about. It's a problem on top of other problems that the Black communities were facing prior to the pandemic. And I think it's just not the mental health of the individuals who are working essential jobs, but it's also the loved ones as well. So like say like your brother, your sister, or your mom or dad, they're going out and working, and these type of conditions during these times, you feel a certain type of way, and that really affects your mental health. So those are all important aspects, not just really looking at the biological aspect of the COVID-19, but also the social and the mental health impact COVID-19 has
Mm-hmm.
and continues to have as well.
Yeah, I've actually I've heard stories of, individuals who are from these communities who are maybe PSWs or who have to work, whatever type of jobs that they have, the precarious work, they don't have the luxury to stay at home. And so
Mm,
if they are living with other sort of vulnerable individuals, maybe children or those who are elderly, they've had to send them to a relative's house or to somebody else's house to reduce the risk of spread. And you can just imagine the, again, psychological impact of social isolation is isolation, right? It is you alone. So you're going through this alone, and then you have to separate yourself from your own child or your own parent or whatever it
mm.
is. And so it is going to be sort of an accumulating effect.
Those are all great points. Thank you, Professor.
Thank you.
Mm.
All right, so now we're going to move on to the next question. So earlier this week, we were able to get an interview with a community health center in the GTA. So today, now I'm going to tell you the response of what they talked about and what were resources that they found were most helpful and most needed. So according to the Black Creek Community Health Center, emergency food programs are one of the resources that are being used the most during this time. Food insecurity, in particular, is one of the biggest issues due to factors such as low income. As a result, the community health center felt that it was mandatory to host an emergency food program for the community. Some other resources provided by the health center were hygiene kits, helping residents fill out CERB/CESP applications for the benefits, and overall, they aimed to stay engaged with clients by virtual care. However, they felt as though one thing that would have been very helpful for individuals without technology would be providing them with tablets to help them stay connected. They felt as though the government should have provided enhanced financial aid so that the community could provide technology to its community members. Another thing they felt Another thing that they felt would have been very helpful for the community would have been providing testing centers earlier. Thankfully, they have received community pop-up testing centers, and the location for this is Christian Center Church, 4545 Jane Street. Pop-up testing dates will definitely be also posted on the website. Overall, thankfully, they have received a testing center, and hopefully better and bigger resources are to come for them. Lastly, a lot of people in the community are living in apartment buildings, which makes the ability of people to self-isolate pretty difficult as the community is very tight and small. When an individual tests positive in the community, it definitely can spread very easily. To combat this, the city and the community center were trying to advocate for for secluded, safe hotel rooms for positive COVID testers to self-isolate. However, it was not possible. Overall, I hope the vulnerable communities in the GTA and around the world as well get the resources they need and live in a safe and healthy environment away from COVID-19. In your opinion, what resources do you feel are currently needed that the community does not have access to, as well as what other resources do you feel are being used the most during this time throughout communities?
Mm-hmm. So I think one of the most important points in terms of getting the appropriate resources they need is timing. I do feel like it's good that all of these resources are coming now when the community needs them the most, now that we know that this community is being disproportionately affected by COVID-19. But it does make you think and question why these resources like testing centers and PPE were not allocated to these areas beforehand. So I think timing is very important. And if we did have these resources there before, it could have, reduced the burden on the population or these communities particularly. So I think it's good resources are coming now, but it would be better if they were there from before. The other point I wanted to touch on was the technology, which I think is very useful. And it makes me think about individuals who need technology to work from home, or students who need the internet to continue with their courses and with schooling, which is still ongoing. And so, the resources to make sure that those individuals, the youth, the students have internet access, have things like tablets or laptops where they can continue on with their daily lives in this crisis is important, and also resources that are needed. And because they're not directly, COVID related, like testing centers or PPE, they might get overlooked. But I think those type of technologies and resources are also needed in those communities. And the last point I would say is about CERB. I think that resource the government is offering is probably one of the most widely used across the population. I know so many individuals have applied for that funding. And I think it does give a certain amount of money per month to individuals, which is very important. However, going back to the point about lived experiences that Rani was mentioning, and individuals have unique needs and unique families, and the amount of individuals in a family and where you live, housing and income, it's all important. And having, this sort of blanket approach of giving everyone a certain amount of money a month who qualify for CERB is important and it's good, but it may not be enough for certain populations, certain pockets, certain individuals, again, depending on their individual needs. And so it's a good resource and it is being highly utilized. However, I feel like there should be more compensation and more resources available to certain marginalized communities in order for the response to be equitable. Otherwise, it's just equal, right? And that's the difference between equality and equity, is some may need more and they should get more.
Yes, you touched on very good points once again. And I agree with you with like the technology thing and how CESP/CERB has been more of a blanket approach. All those things are very valid. One thing that I want to stress is that the technology for people, and especially these communities, since you're self-isolating and since you're in such a like small community, the only way you wouldn't go outside is if you had access to technology. It makes it easier to self-isolate. I guess we'd know that when you have technology, when you have access to the TV, YouTube, internet, you can really spend time inside your home, self-isolating, away from COVID-19. But when you don't have access to these things, you want to go out. You can't just sit at home constantly, because one really important factor is mental health. And you self-isolating and isolating by yourself, you're gonna like, what's it called, feel the impact of it. And that's why technology is very important. And that's one thing I'd really like to stress. And then what you mentioned about CERB and CESP, you actually touched on the second question that we were going to ask you, a follow-up question about whether CESP was too short or whether it's been effective and whether it's been a blanket approach. So yeah, I agree with you that we have to understand that there's a difference between equality and equity. And we can see through CESP and CERB that the government does have the resources to provide individuals with money, right? Even though it's an emergency benefit, but we know that the government has the resources. But it's important to provide the resources in an equitable response rather than an equal response, because there are disparities between the Black communities and white communities and other racial communities within the community.
Mm-hmm.
And COVID-19, as we've seen, is hitting the Black community very differently, and actually hitting the Black community more based on data and statistics that we've gathered around the world and even in Toronto. So it's very important to give an equitable approach to COVID-19, which is a main point of this project, what we want to deliver and the message we want to send. So we just have to start doing these from small little steps, and overall they'll add up and make better and bigger changes.
Another point in regards to CERB, like you mentioned, a lot of individuals from Black communities and other sort of visible minority communities and newcomers as well, a lot of these individuals in these communities have jobs, like you mentioned, like PSW work or in a nursing home or long-term care or a hospital, where there's already a higher risk of contracting the virus. If someone does contract the virus in that type of employment, they have to be off work for 2 weeks. So they may not be getting their regular paid income. And then they also don't qualify for CERB because they have a job and they will go back to work eventually. And so there are people who fall through the cracks. And depending on your work and where you live, those people may be, more affected. And so I think that's all something to keep in mind about that blanket approach, where there are pockets of individuals who fall through those cracks and who may not get this benefit and may not be qualified for that benefit. And so you kind of have to go back to individual needs rather than look at the population as a whole.
Well, on to the next question.
Mm.
How long after a vaccine is produced and the disease is eradicated do you think things will, go back to normal? So what is the new normal for individuals, of color / Black communities? And how, may this be different compared to other communities?
Mm-hmm. So I do feel like that new normal is something that will affect everybody, regardless of where you live or your race or ethnicity. Everyone's life has changed. So you will, just generally speaking, there's going to be obviously a lot more social distancing, which we are already seeing. Signs in the media, and even if you go into stores. So there is, there's constantly going to be that distance between individuals that's there. And, waiting outside stores and not being, you can't just freely walk into a store, you have to be wearing a mask. And so all of these type of changes, I think, are going to be the new norm for everyone. And again, as I mentioned, obviously it'll be differently, affecting different communities, right? Based on things like housing and employment and income, et cetera. And so these pockets of the population, Black communities and other vulnerable individuals, it will affect them as well and differently as well. So if you do, if you're living in an apartment building, for example, you have to use the elevator to get down. Elevator is a very confined space where germs can be contained, for example. And I think certain elevators have rules where only 1 or 2 people can be in it at a time. And so when you think about that, that's just adding time to your day, that's just adding more stress in your life. Right. So even though things are, going back to normal, those little changes in your everyday living space and working space, right, are going to have those impacts, again, psychological impacts, and just impacting your everyday life. And so I do feel like everyone's life has changed, but those individuals in those communities who are most vulnerable, their lives are going to be changed for longer. Right. And if these communities are disproportionately affected and they have higher, rates of contraction of the disease, or they live in these areas, they reside in these areas, then the virus will affect them for a longer period of time than other areas that have become virus free or COVID free. So they'll be dealing with the effects for longer just because those populations have been hit harder.
I agree. I feel like you made a good point with employment. So statistics have shown, data has shown that prior to the pandemic, Black individuals, are less likely to be employed in different sectors. And especially with COVID-19 and the pandemic, we've seen, many stores closing down. So that just, decreases the amount of jobs that are available. And that just goes to show that it will take a longer time for Black communities to, to go back to the normal prior to the pandemic. And even for, social distancing, not everyone can social distance, right? We see these communities, they live in inadequate housing conditions. It's like a community, it's a vibrant community, and they always, like to get together. And these things are harder for these communities, to distance, and that just increases their risk of contraction. And also wearing a mask, this can lead to further criminalization with the police. We see that the police, we see that Black individuals are policed at a greater rate compared to other ethnic groups. And with wearing a mask, this can lead to further problems that can occur. So you mentioned a lot of great points. It will take a longer time for sure for Black
Mhm.
communities to go back to normal.
Yeah, no, those are actually really, really great points. And I think because of the recent events that have taken place in the US and also in Canada with civil unrest, it's really brought forth some of these other issues, like you were mentioning, with something like wearing a mask that's being obviously is being told to do but by the government officials, right, for safety, but how does that affect certain communities, right? You don't think of it in that way, but again, the recent events have really brought attention to these type of issues as well. um, Also, I was reading about certain pockets in Toronto that are already sort of discriminated against or stigmatized because of the individuals, you know, who live in these areas and the type of work or the income level. There's already a stigma or discrimination towards certain individuals living in certain
Mhm.
regions. And once you know that COVID-19 is sort of affecting these areas more, there's risk of a greater stigmatization or greater discrimination to those communities. And so there's also that fear and that can also happen. And when you think about like businesses in those areas, how are they going to, you know, Black businesses, how are they going to deal with that? And COVID-19 has already economically affected these businesses and these individuals, and then how can this greater stigmatization then, you know, cause further burden on the population? So really important things to sort of keep in mind.
I agree. Responses to the pandemic should be tailored to the unique lived experiences of vulnerable communities, and that's what we're really trying to enforce here within this project. So thank you for mentioning that.
Mm-hmm.
Okay, so lastly, for our last question of the podcast, before we make it an open discussion and touch on any other things we may have missed, um, this is more tailored towards general populations. But what are some lessons we can learn from what is happening south of the border in the United States? For example, we've seen recently that uh, cases of coronavirus have spiked in places like Florida, places like Miami, like in all those areas. um, COVID-19 cases have spiked because people no longer want to social distance. People no longer want to wear masks. People no longer can self-isolate for long, right? Because it's impacting their public health. They want to go outside. But the negative about that is that cases are rising. COVID-19 is not going away. There's still chances that COVID-19 are increasing, and we've seen that south of the border. So, what are some lessons that we in our communities in Toronto, in Ontario, in Canada can learn from what's happening south of the border?
Mm-hmm. I think those are really interesting points you raise, and we are seeing that, right, in especially the U.S., where the numbers are, like you were mentioning, in certain states and certain areas are increasing. Um, I do feel like Canada is doing a good job in terms of reopening things. It's just not sort of reopening everything at once. It's a gradual reopening and a constant sort of check where the numbers are at, from an epidemiological perspective, to see how much can we open. And they're really doing it like pocket by pocket, not just like province by province, but even city and town, depending on the numbers and the risk in those areas. And so I think that's very important. And I'm not sure if that's what's happening in the US, but I have heard just anecdotally that, you know, these areas that are seeing these high numbers are actually opening simultaneously. So unlike Canada, that's continuing to be very careful in its stages and phases of reopening the economy. I'm not sure if that kind of strategy is being used in the US. And maybe this is why we're seeing the peak. And so I do commend, you know, the government for doing that and for staying focused on the numbers and how to reopen. I think that's something we can learn, and keep in mind for the future as well. Um, and in the US, I feel like, um, you know, the emphasis on wearing masks and socially distancing, like you're saying, it is being said, it is sort of being presented in the media and through the government, but it may not be as followed. I do feel that Canadians, again, I'm speaking more generally, but are being more vigilant in terms of socially distancing or in terms of wearing masks. Just speaking from my own experience, just going out, almost everyone is wearing a mask, and even if people happen to be coming close contact, they'll give each other space, they'll wait, they're kind to one another. And so I think that's all very, very needed. So it's not just a top-down approach from the government, but the community should also take that responsibility and do those things. And I feel like I'm not sure if that's what's being done south of the border, but it could be that's why they're seeing those numbers rising.
Yeah, you make very good points. And I agree with you with the mask thing. Basically, in Toronto, wherever I've gone, indoor restaurants or indoor grocery stores, anywhere indoor, the employees are very strict, and like the managers inside the stores, that you're not allowed to enter without a mask. And I feel like that's very important because in order to safely open, we need to wear masks. We need to wear masks so that we can stop the spread, because if everyone's wearing a mask, then there'll be little to no spread. But if some people are not wearing masks, some people are wearing masks, then the effects just like negate each other. So overall, I feel like you're right. In Toronto and in Canada, they're taking very like good stages, taking very like good measures to open safely. And overall, I feel like wherever we are in the world, we need to listen to our medical experts because they know what's best. They know how this coronavirus is spreading, and they have good tips for us. Maybe it may not be like something we prefer, but for the sake of like health and for the sake of humanity, we should be listening to the medical experts so that we can stop the spread and get things back to normal. And
Mm-hmm.
overall, I feel like also mentioned in this podcast, testing needs to be more accessible. Testing was just recently provided to these communities, these vulnerable communities especially, but it should be more accessible to all of these communities. I know it's hard to do, but it should be one of the top priorities because you don't know if you don't get tested, you don't know if you have coronavirus, and you could be continually spreading it. But once you find out you have coronavirus, that's when you start self-isolating. That's when you take more measures. So testing is very important. And
Mm-hmm.
yeah.
And to bring it back again, like you were saying, to marginalized communities, again saying that masks should be worn, which should be done because it is sort of the guidance we're getting from public health. But again, going back to things like income, maybe some people don't have the resources to buy masks, right? Something very simple like that. So for those communities or those pockets or those individuals, then they should be given those opportunities or given those resources, given those masks readily available to them. So just to keep in mind that although these behavioral changes are being emphasized, for those who can't or don't have the means to do it themselves, those resources should be available to them.
Yes, I really agree with that last point because people don't have the financial aid or finances to buy masks. Masks are expensive. But what I saw recently in the last week, the stores I went to, like Sports Check and Best Buy, especially, they have masks available at the front door so that if you don't have a mask, they're like, here, take this, and then you'd wear that mask. So I feel like these companies that have like a lot of money and they're also getting businesses from people who are buying their stuff, are taking some good measures by providing masks in store so that people who don't have access to it or people who may have forgot it can wear a mask safely, shop around, still do what they're doing. And yeah, that should be implemented in various stores, especially in like these communities, stores around these communities. The government should be funding masks. I feel like that's very important.
Yeah, 100%. And I feel like the stores you mentioned, I've also seen it. Um, but even things like grocery stores, I actually haven't seen grocery stores hand out masks, but those are the stores that are most like everyone has to go to a grocery store. So those are the stores that are and were open throughout the whole pandemic because they are essential services. So those kind of high volume stores that a lot of people have to access, I think that should be implemented even in those type of stores where grocery stores should just hand out masks and have sanitizers not just at the front of the store but throughout, right, like as people are walking through the store. um, and then just in comparison to the US, I'm not sure, I don't know if they're doing that down there, but they may not be, right, doing that. And that's also a difference between what's happening here versus what may be happening elsewhere.
So, is there anything else you'd like to mention? Any questions you have for us as being our first guest? Anything you'd like to ask? You can ask if you.
I guess just generally, you said you did have your first interview with a community leader, executive director in the community. So, and I know that you've been doing some searches of the literature and just, you know, through those organizations and agencies. So what, just curious as to what have you learned so far in relation to your topic and your main research question? What are your insights so far? I know it's still early on.
The main point we found well, I found within the literature, is that access to healthcare is not really universal, right? We see that certain ethnic groups are face discrimination in the healthcare system, such as indigenous communities, Black communities. They're blamed for the situation, their encounters within the doctors. They don't receive culturally specific care. So these types of things are basically what really stood out to me within our literature review. And with COVID-19, especially if you don't want to go to the doctors, if you don't want to get tested, and if you actually have the virus, then you're spreading it unknowingly. So that's even a greater problem, right? So even accessing testing is basically putting your trust somewhat in the healthcare system. So if you have these communities prior to the pandemic who don't really trust the healthcare system, and we see why they don't. And with COVID-19, if you don't get tested, if you don't seek care, it's just really, really problematic. So that's something I've really noticed within the literature.
And then something I learned from the interview that I had with one community health center earlier this week was that these health centers are really trying their best to meet the needs of their community members. For example, Black Creek Health Center is doing every Tuesday and Fridays food drives. So people have hot meals that they can come and get. They have groceries they can come and get for people who don't have financial aid in getting these things. And like the community health center just opened a testing center, so they're trying their best, but one thing that they need most is funding. And the funding they get is either from donations or the government, but they need more funding for providing these community members technology, as mentioned in the podcast, providing these community members with more testing centers, with masks, with all these things. So they are problems that the community members face, but the community health centers are trying to do their best to combat these problems and help them out. And they need the help of the government realistically, because they're the ones that provide the most funding. So that's one thing that they need the most. And overall, yeah, so that's a main thing that I've learned from the community health center interview, was that there are issues, but there are solutions to that issue. The only issue is mainly funding. And once the funding comes through, they have plans, they have ways that the community members can get engaged, the community members can be in a safe and healthy environment with more resources if they are provided with them. So yeah.
Yeah, I think that's great. And I feel like you mentioned, you've only talked to one so far, but it's great that you're going to be talking to a few in a few different areas. So then that way you'll be able to gauge again those individual community needs that may be different from one another. And that's something I guess you'll learn along the way, that even in communities that are kind of going through the same thing, that there's still differences there, and there's different resources available, and then maybe you can learn from one another, right, and then collaborate in ways to move forward. And so I think the more you talk to, the more community leaders and organizations you talk to, you'll learn a lot more too, and see where the similarities are, where the differences are in needs and access.
That's very valid. Those are some good points. And overall, We are also provided with like a lot of like YouTube videos and links as like the community health center's executive member have they have done podcasts. They've also done videos on how Black communities have been impacted by COVID-19, and there are a lot of articles that they shared with us. So basically, this podcast for the viewers will be posted on YouTube, and in the description I will be posting like the links of these articles if you'd like to check them out, or links to other YouTube videos that have been uploaded during this pandemic. So you all should for sure check that out. And yeah, that's pretty much it. Randy, would you like to add anything, or
Oh, you
Prof?
covered you covered everything.
Okay, yeah. So thank you, Professor Nida Mustafa, again for joining us in our first podcast. Uh, and we appreciate that you were able to take part in this amazing initiative and give us your opinions and thoughts about how COVID-19 has truly impacted Black communities and how COVID-19 has truly impacted the world as well, because we touched on some of those things. Hopefully, in this series, so this is a 3-part series, there will be 2 more episodes. So in the coming weeks, they will also be posted on YouTube or even Spotify for audio listeners. So you guys should totally check it out, share it with your friends. We also plan to have a research poster project and a website. So all these links and all these things that we plan to have will definitely be posted on our YouTube channel, on our description of the videos. So anyways, if you have any questions, you can reach out on the website. There'll be an open blog spot. And yeah, thank you for listening and have a great day. Thank you.
Thank you.
Thank you.